Turning now to an important health story, the number of COVID cases is spiking across the country. Nearly 40 states are reporting high COVID activity levels, according to the CDC, and emergency room visits are at their highest for the coronavirus since February. Joining us now is Dr. Celine Gounder, a CBS News medical contributor and editor-at-large for public health at KFF. Good morning, Dr. Gounder. Thank you so much for being with us. You know, it's been a long time since the very spike of COVID, but it's creeping back. What is happening?
There are a couple different factors here. One, the virus continues to evolve to stay ahead of our immune systems. That's what we talk about when we're talking about variants. Two, your immunity to infection only lasts about 3 months. Your immunity to severe disease, hospitalization, and death, that lasts much longer, which is why people are not getting sick the way they were early in the pandemic. But it is to be expected that every few months, maybe twice a year or so, we'll see a big wave of COVID across the country.
What are the current guidelines if you test positive for COVID?
So the current guidelines are you should be staying away from others for at least 24 hours, at least until your fever resolves without the help of a medication like Tylenol and your symptoms are improving. But you really should be, as much as possible, taking additional measures for at least 5 more days, which is when you're most infectious, most likely to transmit to other people. And that could include a couple different things: continuing to isolate, wearing a mask when you're around other people for an additional 5 days, or opening windows, having those HEPA air filtration units to reduce the risk of transmission.
Okay, so what about in general? Do you believe that people should be wearing masks? Not believe, but if you're in a place where there's mass transit, airport, subway, train, and then what happens if you start to feel sick? Should you test at home?
Well, I think it's common sense, right? If you're feeling sick, probably should get tested. When you're feeling sick, probably shouldn't be around other people to the degree that you can avoid that. And we know masks work, contrary to some opinions. They do work to protect you if you're wearing a N95 or KN95 mask. And they also work to protect other people if you're infected.
And apparently, if you test positive, drop out of the presidential race. That's important to remember wherever you are.
Sign from the Almighty.
Gounder, thank you so much. We appreciate you, Doc.